Hi and welcome. I'm trying to learn medicine today, Coeliac disease. After we've done it, we're going to do standing yoga. And if you participate in the standing yoga, that is at your own risk. And we're talking about a disease, internal anatomy, and eating disease. And this is no medical advice, so we're just reading about it. Coeliac disease. That is a rare disorder in which the patient is unable to absorb essential food from the intestines. Coeliac disease runs in families and commonly affects babies, while mild cases might not be diagnosed until adult life. Okay, where the intestine is not properly absorbing the things in the food. At least some of them. And it affects babies, but mild cases are not diagnosed until the adult life oftentimes. Symptoms in babies. Failure to thrive and grow after weaning between the age 6 to 18. I don't know what weaning is. Okay, they don't grow between 6 and 18 months. The child is often miserable and weak with wasted feeble muscles and a distended abdomen. I don't know what distended means. Okay, the child is miserable, weak, and has feeble muscles. And now we're talking also about defecation. Stools are abnormally bulky, soft, pale, and exceptionally smelly. Symptoms in adults. Unpredictable attacks of diarrhea. Stools are typically pale, bulky, frothy, and greasy and tend to float. The patient may suffer badly from wind, and the abdomen is often distended. Wasting and weakness of the rest of the body. Duration. In children, the disease may last into adolescence when it tends to subside. It may recur later. Why does it subside? Okay. Causes. The disorder is due to an intolerance of gluten, a protein found in wheat, barley, rye, and possible oats, and so symptoms do not appear until flour is added to a baby's diet. Okay, the disorder is due to an intolerance of gluten, a protein found in wheat, barley, rye, and possibly oats, and so symptoms do not appear until flour is added to a baby's diet. Now, this book's from the 80s. It might be that some things have changed here, but we're saying that the first initial sentence, maybe something has changed in the knowledge in the 80s, but a rare disorder. Now, next thing, complications. If untreated, growth and development may be affected. The child easily contracts infections of all kinds. So if untreated, growth and development may be affected. Vitamin and mineral deficiencies may cause anemia. Sore tongue and mouth, thinning of the bones and a tendency to bleed. This all sounds pretty drastic, what is all here. A rare disorder is all pretty drastically. So misdiagnosing seems not to be that obvious, but maybe there's more to it. If the symptoms persist for several weeks, then to consult the doctor. When to consult the doctor? If the symptoms persist for several weeks. What the doctor might do: send the patient for tests to confirm the diagnosis. So making a test to confirm the diagnosis. Advice about diet and supply prescriptions for gluten-free dietary products and any necessary vitamins. Let's do it again. Advice about diet, so about what is to eat, and supply prescriptions for gluten-free dietary products and any necessary vitamins. Okay, there's told what not to eat because there's gluten in it and what to eat instead, and also which necessary vitamins are to obtain or whatever. Rice, corn, or soy flour can be substituted for wheat flour. Okay, we're saying rice can be eaten, or corn, or soy flour. Suggest that parents and other children of the family be investigated to see if they are intolerant of gluten. So they said it runs in the family. So suggest that parents and other children of the family be investigated to see if they are intolerant of gluten. Outlook. Once the offending foods are cut out of the diet, the patient will enjoy normal health. Now, what were the complications? The complications were, if untreated, growth and development may be affected. The child easily contracts infections of all kinds. Vitamin and mineral deficiencies may cause anemia, sore-tongue, mouth, thinning of the bones, and a tendency to bleed. Symptoms in babies: failure to thrive and grow after weaning between the ages 6 to 18. So I'm going to read now. The child is often miserable and weak, with wasted, feeble muscles and a distended abdomen. Stools are abnormal bulky, soft, pale, and exceptionally smelly. Symptoms in adults: unpredictable attacks of diarrhea. Stools are typically pale, bulky, frothy, and greasy, and tend to float. The patient may suffer badly from wind, and the abdomen is often distended, wasting and weakness of the rest of the body. Anemia. Here's anemia. It is written with an A. Anemia. A reduction in the quantity of oxygen-carrying blood hemoglobin in the, I can't remember it. A reduction in the quantity, so in the amount, of oxygen-carrying hemoglobin in the blood. Why can't I remember it? Because I don't understand the word. Sorry, I have to look up where the word comes from. What are the pieces out of which the word is built? Anemia. I've been looking at it for the first time. For the second time, but we were not previously. No, that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now Western yoga. If you stay and participate in Western yoga, then it's better the arms. We're starting with eagle swings. Feet are together and we're breathing in the left and the arms up. If you participate in this, better the arms. Okay. And out the arms down. And again, this was no medical advice. I just read for it. Breathe again in. And out the arms down. Again in the arms down. And out the arms down. In the arms up. Out the arms down. In the arms up. Out open to the side. In the arms up. Out open to the side. In the arms up. Bring it in space between the toes and out open to the side. In the arms up. And out and sink halfway down. Before you come up. Out open to the side. In and up. And out and sink down. In and up. Out the arms down and we're leaning onto the knees, standing cat and cow. Breathe in. And out, make a round back, head of the back cat. In into the middle. And out, the belly of the back, cow. In. And out, the cat. In into the middle. Out the cow. And in into the middle. Out come with the round back, up, back into the top, back with shoulder. Again, the arms up. Out, up to the side. In the middle. And out, bring all the sides down into the chair. We then come halfway up. Higher up. And out and come up. Breathe in, reach high. Breathe out, open to the side. In into the middle. Out, the arms over the sides down into the chair. Breathe in, come halfway up. Higher. And out and back up and up. Now we can come up onto the toes. And breathe out and sink it down into a chair. Breathe in, come up. And out and down. Again, in and up. And out the arms of the sides down, feet together, long straight legs and hanging down. The doing the marmot, breathe in and bend the right leg. And out and stretch left leg. In and change. And out and stretch right leg. In and change. Out, stretch left leg. In and change. What's the right leg? In the top of it. Up and down. The penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in, hand down. Breathe out, hand down. Breathe in, left hand up. And breathe out, bend the right knee and look over the left hand to the left. Over the left shoulder to the left. In, arm down, out, over extreme. Now the pelican, make a hand with space between the feet, shift the weight to the heels, and breathe in and count out. And out and come up again. And down again. And out and up. And the last time back. And out. Now the trailer is counted. Take hold on the elbows and gently swing from side to side. Both arms again down, your feet together across the feet, and breathe in, come halfway up with a straight back into monkey half lift. Breathe out again down. In halfway up. Out and down. Breathe in the up diving swan, arms off the sides up, and bring them again down. Now, the garden pose. The toes to the outside, all in a space between the heels. Breathe in, lift the arms up. And breathe out and sink down and place the elbows against the insides of the knees. Breathe in and straighten up. And you can breathe up out and cover the back up. And breathe again in. And out back into the garden pose, or you do the variation, you breathe in. And out you come up in one straight line, you can come back if you like to. The arms down, again in, the arms up. And out. Back into the garden pose where you have gone back or up. And again, breathe in, straighten up, and out, go either back or up in one straight line. If you go up, tuck the pelvis in and come up in one straight line with the crown of the head first. Breathe again in, and out again, back into the garden pose. Breathe in, straighten up, and if you go up, tuck the pelvis in and come with the crown of the head first up. Arms down and up, and out and down, and last time. Breathe again in, and out, we're coming up in one straight line, you can go back again, arms down, and last time into the garden pose, we're breathing in, and out, we're ending the garden pose by coming up in one straight line. Next exercise, you can do it again, a variation, you have the legs standing quite apart, and you breathe in, and out, you round back down, to the ground. And you bend the knees, the elbows to the outside. You can come over the garden pose or just round back up. And the other variation, breathe in and down, further back. And just up again. So, good shoulder. Or you do something else with diver, but that can go to the back, arms to the side, breathe in. Out, lean with a straight back forward. This can go to the back. Make a round back. Come with the crown of the head first, wieder up. Again. Breathe again in, and out, lean with a straight back forward. This can go into the back, make a round back, and come with the crown of the head, again up. One last round, breathe in, out, straight back forward, round back, and crown of the head, first up, and arms down. Now statue of Venus, intertwine the fingers behind the back, bring them over to one side, torn up, shoulders back, breathe in, out. Head over to the side of the hands, arch chin down to the clerk. Breathe again in. Out, pull the shoulder in and down. In, lift the gaze, turn out to the other side, hands over to the other side. Breathe in. And out, chin down to the clerk, pull the arm and the shoulder down. Lift the gaze, turn it back into the middle. The feet are standing together, breathing in, lift the arms up. And breathe out, lean back, draw the shoulder blades together. In and the arms up, we're doing the mark over, cross the fingers and turn the fingers to each other. And breathe out, reach the front all of the back of the chair. In the arms up. Out, lean back, draw the shoulder blades together. In over, cross your arms again, intertwine the fingers to each side. Breathe out, reach the front all of the back. In the arms up. And I would lean the long arms back, the sky. In the arms up. And out and back. In the arms up. And I would bring more of the sides down between the cactus, collecting its things into the evening, bring the hands to touch, lower them down towards it. That was the Standing Yoga. I thank you very much, and until the next time.